Each year, millions of elderly individuals over the age of 65 will experience a fall, and many of them will fall again soon after the first fall. Often, these falls will result in serious injuries, such as fractures or head injuries. In fact, according to the CDC, individuals annually over the age of 65 are hospitalized as the result of a fall. In addition, falls happen to be the second leading cause of unintended fatality in the world. And they are the leading cause of death in individuals over the age of 65. The prevalence of falling and its accompanying consequences in the elderly is a significant problem, and the problem is even more exacerbated by unreported falls that go on. In what follows, we'll discuss the problem with falls in the elderly and the associated causes and complications associated with these falls. We'll also cover some of the preventative measures to decrease risk. Because we know that the leading cause of elderly deaths, injuries, and hospitalizations is falling, it's important to identify the primary causes of these falls. Some of the common causes of falls in the elderly include general weakness and osteoporosis, medication side effects, stroke or heart attack. As individuals age, they have a higher risk of falling due to the fact that older muscles will lose some strength over time. In addition, osteoporosis, which is the condition where bones become more brittle and fragile, often due to calcium or vitamin D deficiency, is a very common elderly condition. The combination of these issues will increase the risk of falls dramatically. Medication side effects. Certain medications have been found to be a well-documented risk factor for falling. For example, medications used for the treatment of such conditions as high blood pressure and heart disease can cause the side effects of dizziness and fainting. Some individuals can be especially sensitive to high blood pressure medication, and the medication can cause a significant decrease in resting blood pressure. When this occurs, the risk of becoming dizzy and passing out is quite high. In addition, certain heart medications can also cause these same side effects. Stroke or heart attack. It's also possible that an acute medical illness, such as a stroke or a heart attack, can also lead to falls in the elderly. Other potential causes for elderly falls can be decreased vision, slow reflexes, or cognitive impairment. Complications of elderly falls. There are several complications that can occur with elderly falls, and the risks of these complications occurring can be quite high in the geriatric population. Head injuries, hip fractures, bleeding complications. Head injuries can occur more commonly in elderly individuals because they are less likely to be able to protect their head in a fall compared to the younger population. These injuries can be as simple as a bruise or as complicated as a traumatic brain injury. One of the highest incidences of traumatic brain injury is in the over 85-year age group. Hip fractures. The rate of hip fractures in the elderly is rising each year, and most of the causes are accidental falls. In fact, in 95% of the cases of hip fracture in individuals over the age of 65, the cause of the fracture is a fall. Bleeding complications. If an elderly individual is on blood thinners for a medical condition, the risk of bleeding complications post-fall increases significantly. For example, head injuries that cause lacerations of the scalp in these individuals can be even more dangerous since the scalp is a high preventative measures for falls in the elderly. Because the causes of falls can often be linked to the sedentary lifestyles of the elderly, some of the most effective preventative measures for falls include exercise and physical activity. Some of the best preventative measures that an aging individual should implement to combat the risk of falling include exercise, environmental adjustments, visionary interventions, and the use of certain tools such as walkers and wheelchairs where necessary. In addition, older individuals must understand that their age will require specific adjustments to their behavior, and they need to be willing to accept assistance in certain activities. When taking blood pressure medication or heart medication, it's very important for the individual to closely monitor their blood pressure throughout the day to make sure that the medication dosage is correct for them and that their blood pressure does not become too low for them to walk upright without assistance safely. Using a cane or walker is helpful when taking any new medications to help prevent falls. Healthcare providers must determine if the risk of fall and injury is higher than the benefits of medication treatment for elderly individuals. Final thoughts. Falls in the elderly population can result in significant complications. These complications can markedly impair an older individual's quality of life. It's imperative that the utmost attention be paid to efforts aimed at preventing falls in the elderly population.